Good morning. I'm on my way to radiation number 14. After today will be exactly halfway. We'll be 14 down, 14 to go, total of 28 radiations. I saw Dr. D on Friday. He says everything looks good. Getting a lot of compliments on my skin and how I'm not burning yet, and I'm very happy with that. I have a very strict skin routine with my lotions. I don't just use one, I use more than one. I think it's so important to take care of your skin during this time where you're being exposed. I think some people get more. Most people get like 33. You can get more than 33. I'm getting 28. You can get less than 28. You can get like 25 or whatever it is. So important to take care of your skin during this time because, you know, with your reconstruction, it could make your plastic surgeon's job a lot harder. And overall, you know, peeling and burning, and you can't, it hurts to move. Nobody likes that. Nobody likes getting burned, especially like, you know, think about summertime, and nobody, who wants to get burned? No one would raise their hand and say, oh, that sounds like a good time. Wearing my Eagles hat today because it is the playoffs and we won last night and we are still in it. And if you remember from my episode with Kathy Lane Hoda, I'm going to the Super Bowl. So fingers crossed that my Eagles make it. I know they will. I got all the faith in the world that they will. Won by 1 point last night, and the other team went to kick the field goal, and it actually hit the post not once but twice. Just shows you that God is an Eagles fan, and He wants us to win. All right, I'm at the hospital now. I should probably concentrate. Good morning. I am on my way to radiation number 15. Skin is starting to look a little red, I'm gonna be honest, but it's not peeling, so I hear that's the most important part. Later in the afternoon, I'm going to see my oncologist, Dr. Cowan. I'm sure he's going to want to see what my skin looks like. Other than that, I don't know what we're going to talk about. I know he wants to start me on medication after radiation is done. Medication including Xeloda. Xeloda is a drug that they're giving a lot of triple-negative breast cancer patients. And since I had a second mutation of estrogen-positive cancer, they are going to give me tamoxifen, which is a common drug that a lot of people complain about. But if it keeps you alive, then you just take it. And that can be like a 10-year drug. So I'm sure we're going to talk about those drugs today at my appointment. And he could possibly send them over to my pharmacy. So in 3 weeks, I'll start taking them. Excuse me, once I finish radiation. Or he could say, see you in 3 weeks and we'll talk medication. Also, I don't think I shared with you guys, it's Tuesday, but I follow someone, Natalie Augustin. She's crazily inspirational. She's joined forces with her fellow thriver, Stephanie Sieben, and they created this, power force called the Thrivers. They consider themselves Thrivers, and they're actually writing a book. So they have a Instagram called Thrivers Guide, and they're writing a book, and I can't wait to get it. So with that, they're actually starting this really cool challenge. So I've been partaking in that. It is called the Celery Juice Challenge. You probably heard of people drinking celery juice. It's pretty popular, pretty hip to do right now. I got a juicer for Christmas, so I've been doing the challenge. It's 16 ounces every single day, empty stomach, nothing before and nothing after for at least 30 minutes. I've also been doing keto since November, so I feel really good with keto. And I also do intermittent fasting. I really like intermittent fasting. I feel like I'm still not that hungry from chemo, so, you know, trying to eat better and do all these things. I think the number one thing you have to remember is that, you know, when you do like lifestyle changes and you change your diet, you shouldn't really think of it as much as a diet. I don't think you will be successful, because if you think of it as a diet and you're not enjoying it, you're just going to go back to the way that you always ate. My body actually really agrees with keto. And I'll tell you what, like, of course you're going to have cheat days and you're going to go out with your friends and your family and, you know, you're going to eat whatever you want to eat, whether it be pasta or whatever. And it's funny, when I eat, like, I mean, I'm not a big sugar person. When I eat sugar, it makes me nauseous. But if I have, like, one cookie or whatever, like, my stomach is just like, no. First of all, Cookie, you don't belong in here. And Kelly, what the heck are you doing eating this stuff? And my stomach actually, like, will yell at me when I eat bad stuff. But anyhow, yeah, so I was doing that, and, you know, celery juice challenge. Today was day 3 of that. It tastes horrible. Full transparency, it tastes horrible. But you just plug and chug that shit, and it's going pretty well. So I'll keep you guys informed on any big changes. But definitely check out, if you're on Instagram, check out Nally Augustin, check out Stephanie Sieben, and check out the Thrivers Guide, and look out for their book that's coming out this year. Good morning. Today is radiation number 16. Let me see if I can do that. 151. Went and saw my oncologist yesterday. He looked at my blood. I was so certain that my red blood counts were going to be low because I've been so tired, and it felt exactly like how I felt during chemo. But they were actually pretty good. My white blood cell count as a whole was just low by a point. But as individually, they were all over the place. Like, there was one, I don't know exactly the full name of it is. It's GRA, whatever they abbreviated on the test, but it was like extremely high. It jumped up 25 points since last time I had that test 6 weeks ago. The highest it should be is, I believe, like 60 something, 66 or whatever, or 63. And I scored an 88. So we're going to look at that again in 4 weeks. When I see him again in 4 weeks, we are going to talk medication. He seems like he's on the fence whether he wants to treat both cancers. Obviously, I am a triple negative first, and then during my mastectomy, they found estrogen positive. So originally he was thinking, okay, let me treat triple negative and estrogen. But he's like, your characteristics are most of a triple negative. And Dr. Cohen's so amazing. He follows and he goes to so many, he's always learning, and he goes to all these cancer conferences, and he follows all these doctors and reads all these studies. And this one doctor that he follows says, I don't care if a patient gets a second mutation and it's like 1% cancer of another type, you treat that second type. So he is going to figure out what exactly he wants to do. If he's just going to treat me for triple negative, or if he's going to treat me for triple negative and estrogen positive. Which, that's tamoxifen. That's the long drug. I'm open to whatever. He's the genius. I will do whatever he tells me to do. But radiation's still going good. Skin's looking red, but it's not hurting. Lotion. I actually can like talk to you guys about a couple of lotions that I do use for radiation that might be able to help you. But yeah, everything's going so good. Today's Wednesday, so technically I have 2.5 weeks left of radiation. It goes so fast when you go every day. Crazy. But here we go. I'm turning into the hospital right now. Good morning. On my way to radiation number 17. Still doing well. Doing lotion like crazy. Everything is going as good as it can be. Still not in pain. Redness, but I don't really know if you can fight redness. As I'm driving to today's radiation, I'm listening to music and wondering if anyone else can relate to this. So when this time last year, actually today, 1 year ago, I saw my OBGYN about a lump on my breast. And she, told me to go for a mammogram and all that. And I was like really scared and nervous. And I reached out to a friend and I said, can you recommend me new music? Because I'm going through something right now and I just need a distraction. So he recommended this band called Microwave. They're from Atlanta, Georgia, and their album Much Love. It is amazing. Thank you so much for recommending me to get that album. He literally told me, he was like, you can literally get any album from them. They're really, really good. So, unfortunately, I associate that album with breast cancer. Because they had some, like, really good songs on there where, some of the lyrics resonated with me for what I was going through. And I still listen to it to this day, but because it's a really good album and really good, band and everything. And I actually had the opportunity to see them when they played in Asbury Park and saw them outside, and I said, listen to your album while I was going through breast cancer treatment, as I still am going through breast cancer treatment. And it was really awesome, and I think they were kind of taken by that, like, whoa, But yeah, do you guys listen to anything that maybe takes you back to a certain time or makes you think of a certain place or what you were doing in your life then? For me, that was Microwave, Much Love. If you never heard of them, if you're into like, I wouldn't call them indie rock. I don't know. Like, they're like a rock band, but I don't know. Go check them out. And I will continue updating you on my treatment. Good morning. I am on my way to radiation 18. It's going so fast. I can't believe it. I will have 10 more sessions after today. We'll be finishing in 2 weeks. Oh my God. So today will be the end of week 4, right? Yeah, because I'm doing like 6 weeks. Week 4. Wow. I can't believe it myself. I think the skin's getting a little tight. It's obviously red. But let's be honest. Session 18, not burned. Like, I'm red. I mean, red means you're burning a little bit, but it's not painful at all. It doesn't hurt when you touch it, and, you know, I can completely move, and I'm still going to physical therapy, and I'm still able to do all those things, so that's really, really good. I think my lotion routine helps with that, without a doubt. Just gonna keep doing, you know, my thing, and so many exciting things are happening. I got invited to the breast cancer conference in Miami in March, and I'm so excited to go. I love Miami. I've been there like 2 or 3 times. I don't remember, but I love it, and I can't wait. And the Super Bowl is coming up. Just so many exciting things. You know, you go through this wild and crazy journey and doing all these terrible things that you never wanted to do in your lifetime, and all these fears you had to face because it was either do it or die, and, you know, nobody wants to die, so you do the stupid thing. And, you know, the universe works in mysterious ways, and you get all these wonderful opportunities come for you, and, you know, no matter what you're dealing with, no matter what your health situation is, you know, there is a silver lining in everything, and so grateful for all these wonderful things I've been experiencing and different opportunities, and yeah, it's been quite a ride, and I'm happy to entertain you while on this ride.